Facebook page,
securing your future.
and on air.
Now, Sumuta, Project Manager ki Dr. Samson Fosanga, Clinical Director ni PSH Hospital ena singalevuni kwa, maina clinical role kinandona kaloko, rawa kasarava live ena VitiFM Facebook page, na Vakariba Malamala, ikaw tiyan ifikimu ni na PSH Hospital ena VitiFM, eka mitha ngai kachi.
Mulur turana marama turumuna maneleo, vikita bukibiki mni pombo tisambala mnono sa gilistal mai vikita na takono gorota kina Vakariba Malamala, era do vito kurikina na bikambani so era do ngandreva. Meron may bada takan na itutuke na numi may bada taki beke dan liru bunua na bugu na tangarabi siya na nonda bukei na bi lenga so siya na bole so eto yung matandi dapat beri bina kaya na singali bunikua nirto may niro may nonda bulang itiko na turang rua raw na ibalislis ni PSH kaya ko rin batarani na dapat PSH na kaya bombalam adokan Pacific Specialist Healthcare ada buli bingar abi ana tapari ni bula weekend dan lino benua ka tu bingar besar tu ngago ena kor turang isu kero mebi talu ci watiki turang nita na kena project manager Solomon ne sumut turang ni kadau kata juga ni tu tibunga ena bidang ana longa satu sar ci bingar abi sana no meeting mana kai bali utaki tu na bika so era turang numero turang karabi kada kina ena singa bina kuah sera be singa ni mata. And we also say talufa to our friend Dr. Clinical Director, Dr. Sensen Fausanga, who is here with us today for our talkback show from now till 1 p.m. Problema kena turang, talofa Dr. Sensen?
Talofa.
Problema kena turang naik?
Boleh benar dah.
Na boleh besar, saya atur nanti buti karena segala beriku ni talno membelatan na bali bulogo na PSH Hospital to Dr. Sensen. How did PSH first begin? And what inspired its formation?
PSH first began back in 2016 from a corner of in Turek, where this
just up the road.
Just up the road, where this group of inspired gentlemen get together and think, and basically over a small discussion on the needs of health care here in Fiji, and that was led by the founder and the owner of the hospital, Mr. Pavish Kumar, and it started back in 2016, and then to 2017 they started off with the project to build the hospital in Wallaby. And from there on is history, where we move on to advanced super specialty care in our setting in Nandi.
So from Turek you moved to Wallaby till today. Then Turek, total la kau di memang kurang unit tu kan kena tahu kita kena beli bulu maka dasar balik.
Iyo, benar kena na kena tahu ya bukan apa nana nungan ni kena tahu bukan tunjuk Dr. Sensen ni aku nukun ditanya itu lagi sanggil mata nata kiwan dulu.
Iya.
Napa nana ya na nana tu kicungan balik tanah kena sangai mengkarabi sona bingkarabi ni tambah nimbulo bikin tanah lini bunua. Me very advanced stock
Alright. Iya.
Very advanced stock kan rendre to kan me rentung karabi ngamai tai. Lebu bingkarabi rentung lingkarabi ngai tai. Manir to ngole maikin na letinin na buniway to specialist kelan tao. Arto stungango buniway Sireli, Dr. Ellen o Dr. Jamesa. Tulisin. Kita may to yung takapatan na runundul chinikaw no iwalu. To yung kinan na visele inpatient non karabi ngo mesangay chungo kan na patient to kora biang karabi nga pa private. Mesando nga na walimbulo mersang karabi nga kin.
Okay.
Amani to yung kinan may walu ya kito sangay develop chiko may walu. Kaya na nananu nga ya. Meto yung utagebi tinabi matanggal ibing karabi veverin doon tua. Ning ibing karabi watang panimbulo kan doon karabi tigo may walangi. Mesakaw nga may babola kan on tamatawur.
Right.
Main karabitok ngai viti sa kuone nda buka talvaya ambaleta vita na mbaki sauti ke to angole India.
Yeah.
Chini ne au ke Korea, Hong Kong, geli lako tali Mumbai, geli lako India.
Yeah.
Na kota ni buka vaya, wa kota li so mital ni bondo sandala ngamai papole keke. Tono ke vital lota chuni ne au ngon na vingkarabi so sama India walau chuni goti mai wan.
Don mo bina pombo tiri tukutu rong bina ka bikin den nalili bono ni borong cuma na single bina ka rikua. To Dr. Sensen, what are some of the biggest challenges you are tackling right now?
Some of the biggest challenges that we face as a private hospital provider is basically the support we get from our state, yeah, and also one of the main element of challenge is based on the need for doctors, and the lack of doctors in Fiji who are able to practice in the private health sector is an alarming concern at this point, and I think the authorities should also look into supporting mechanisms to make sure that there are enough doctors in the private. There are pathways that can mediate doctors into the private sector to be able to work in private hospitals, just like PSH. Yeah.
So just a follow-up question on that, Dr. Sensen. So all the equipments that are used in the hospital is funded by the hospital?
Yes. Yeah. That is from the beginning. That is one strength of PSH. The innovative minds of the people of the team in PSH has brought in a lot of advanced technologies from day one. These technology include ultrasonic. As of now, we have neurosurgical equipments that are very advanced in their function as well to enhance operation needs, especially for neurosurgery. We have ultrasonic aspirator, which can cut the operation time by half, 50%, which basically our neurosurgical team is quite excited about it at this point. Not only that, we have advanced cardiac equipments which we are currently using to help our patients with heart disease, such as stenting, and of course the endpoint treatment that we have at the moment is open heart surgeries, whereby we also go into doing surgeries with double valve replacements, single, double, triple vessels bypass, which we don't used to have before here in Fiji. And now PSH is providing that.
Toto kabuti na mga malalabi kami nakata tabarang chibir turang ruh ibang silisian na Pacific Specialist Healthcare and nonta panua sa PSH Hospital na clinical director Dr. Sensen Fusanga na bekata may tubalu bagakin na be turang nita project manager Solomon Suguta. Tapi talot juga dengan orang turang na tur Santos formal when kaya garabiti ko na cardiac unit sa na heart center. To both of you gentlemen, can you just explain to us the cardiac and what's the meaning of cardiac and you?
Cardiac basically refers to any issues with your heart. Everybody should know that any of the diseases that relates to the heart comes under this term, medical term cardiac. And these diseases include basically what is well known now is rheumatic heart disease, valvular heart disease. Some of the other diseases are disease whereby blood vessels to the heart narrowing or block, which is called ischemic heart disease. Yeah. And valvular heart disease. We also have other issues with the blood vessels in the periphery of the body, where we have the vessels being narrowed or blocked from other diseases, both diseases of the blood vessels and also from secondary effects of diabetic type 2. Yeah.
Don mo na kila turanet ni teman to kala pamadal ni Dr. Sansen dan Sigli ko.
Right, nambag ngo sa magiliwa ki no PSH, ngo indo chukon na itugutugo matin de boy weekend ay viti kana Pacific. Ni sa may taw ya burongo na vingkara viniuto, na kana veta ivakin dondu. Na veta ivakin dondu ngo ke va kana babanta babalang ronika and tertiary care superiority ni kadek. Na balmale na vingkara vingo na kai matin de weekend ta. Balata siya nindo na kananta wichi ko wichi. Kaya so erandike binilang katsuko non rauto sera matini uto se so na kai relate wana uto e senga ni ro ni retreat ta kiviti liwe keto sangai taka keto sangai develop ta kana program ngo mesa ta kasar ngai vitu ro ngo bulka pana u ke pakai ndu elenga non auto se ndu na attack mai ndu na sai viti se na pasifika mai na neto volim bulo mai nandi e chiko ndu na wing na ketlep chiko ndu na wing na vol visel ke pakai sarani durunga mai mesa mai road develop te kibat bate ka pakai nduang attack mai se ndua sala ko mainton indication sabe langa chukundon ngal no auto arani la ko mai la ko bana ket lab la ko angiogram lo ke pakai block stand ke pakai sa singron stand tagi me clear tagi na salin ra ko block juga ala ko sarisan ndua ngaran li ra kana bypass ko na ka senga chukuni ra ka roi bitingo right imbalata ni sanga nindu na kenanda me ra ka na visel rauni ra kana jike bini uton na stenting angiogram yo na kena sel ko sa block sing rauni ra ka kina me stent tag me clear tag sing rauni do visel ya na ka ko matinda weekend na tukutungo ya saranga ko sanga ya tongo ibit ya na level tu sa bongo ibiti arandola ko tunga me na visiting team visiting team rang la ko tunga mai ko to men non misini wa tigir na kenan tau ramai vinga ravinga ma da ru cara lifestyle ko total non rakila kara ko total non misini da ke to sa ka ke to tarasa ngai ke na wanga buka ke to sangai ko to mo ko na kenan tau mai pilot ta ke na wanga bukong na program ni ke yo penat dulu na sing indo talela atu ke tunga ko na taro do susa turu nai do taro ke bale apa go ke pakai ndua sango le palimbola le usala itu ku di bawah disa cu lori kana ne bata kil di mati di uto edaba en ngandre ko done vola me rifuti me kya bikim do se no ko sara tu patru ni lagon bikim do bodudum nada bona moni sala di bito sa ki wir na tu mat raunir tu bi wakauche nur tu ministry Begitu, saya kayak bekas sama nanu mangau patient melakau ni ren kota ngani kota batan nono bola nono medical report ike, besar darekan. Yo kayak bekas sana lakau ni, oke sana liso mana nono karabi, kayak bekas wakau ciko en nama tentu, na ministry en nagai vital nota kana kena sumi, ya bulu sau cara lakau nama teni bidana referral mana nama tentu, mana naka benakin. Ni bagan naka irna leni bonur salur raya viti, mana maten paling bulan maten tu. Sati ke bu bi bakot stel cungai na paling bulan maten tu begitu. Malatan sacu begitu na level ni bingkar rabing ko. So Dr. Sensen, rather than sending the patient to overseas, where the cost will be much more, it's better for them to visit.
That's right. That's right. PSH is a super specialty hospital. It's a leading super specialty hospital here in the Pacific. It is a Fiji-made brand hospital. But if you look closely at it, it's Pacific. So it's a Fiji-made brand with a vision for the Pacific as well. And in terms of the patients coming in from the Pacific and also from our local hospitals and referrals, they come directly to us, and we are ready to provide the end point treatment that you are also getting in countries like Australia, New Zealand, and India, even Malaysia. So that's basically the coverage that we have at the moment. It is that advanced, and we not only that. I think what is also important is to mention that we have a team of experts right from the outpatient. So of course, the bulk of patients coming into our outpatients, then from there they refer up to escalate the care up to our specialists. With our heart unit, we have the complete set of care that is available for our public here in Fiji and also the Pacific region. So it is important that our people here in Fiji knows that you can get an endpoint treatment here in PSH Nandi Hospital.
Tutto come ti mikro kada hangon sini bas levo na Vakariba Malamala salika ka burra ki VitiFM sibita ba keda tini karu na rusa na bulu gadir miniti. Turonet na project manager Solomon Sunuta turonet talo tamanda sona complex cardiac cases dos agarram sina mano ko bibiti kon na double tissue valve replacement. Ni ba madal madakina talo madakina wika dari sigili bulu.
Kor sana matanggal living karabi ko asang atun nindong karabi rawe viti. Ono ba madal takaromanda kon sona bypass wata kena valve. Iliu ando lang tu mesona visiting team rani ruangan blok dua ruangan blok rato main karaba. Kaya satu lu wana blok sa sing rani karabi ko santu ko lista di walang. Rani karabi walang. Nangon na kitu develop takina ketu sangat serami ketu itu na level der mesang karabinga viti aman ketu rawatongo na rede juga sona netu patient testimony ira tulu va nana ngasalin rai blok non ruto samai lakaron non bypass karon ni program ni utu ketu takawango kon valve replacement go ko irna non valve ni non ruto sando tubi mate si
Kalau tak mantan uto na ba na
Yo na ito using ni bunuay o na kay matalkin na. Iyo.
Okay, all right.
Nangon na kito program na takawagin na program ni Val, may kito rawat at talinga na Val. Malete libuchi ko nung to RHD KCVT wir nangon ni. Koso nangon na kordo ulo ti ko na bibula.
Committing a disease.
Iyo.
Isa.
Irango sali butungo ibit. Iyo. Na kaya na trip ta kaya siya nga chuko. Na kito sa manita po takin na. Kaya manilele bro tungo ibiti misa tu talang ngo ibiti na kaya wali mera wali kina. Laten do na dorogo wasuki na ngoni may sabusaw.
Right.
Yang baki rosa nga ka tulumbe ka si rosa nga wa.
Iya.
Ya ngo na ko ya dulu tu may no nangon ni may to ngo sangay may biso ta kina no naval.
No naval.
Iyo. Rua iyo. Ya ko na kanre sara. Iyo o biti to wa bina kan saya do klasa kena ngo nga mi sana ya bakina ibiti. Sana develop kina kanggo baletan na wal ngor angge pamatal kino bunuing
Doctor,
na neto mini
please take us through the heart.
Well, basically the heart have in terms of a disease, common diseases are coronary artery disease, which basically means the coronary is refers to the heart vessels, and the artery is basically the heart vessels, and the disease means the blockage or the narrowing of the blood vessels to the heart. So when that happens, the blood supply that fills up with energy and all the goodies for the heart is also limited, and at times it blocks and people end up having a heart attack or what they call myocardial infarction. And in other diseases, other group of heart diseases include the valves, and this usually is a disease process from earlier years. Kids often get sores or sore throat. These are simple things that are treatable, but the public the patients end up being careless, and not reporting to the outpatients for their treatment. When they were young, and then the bug or the bacteria that causes those disease end up producing other chemicals that impact the valves, and starting from the progressive damage of the valves goes on to the stage that it damages the valve. And the valve basically regulates the flow of the blood in the heart to the lungs, and from the lungs to the heart and back to the rest of the body. So if that is affected, basically the whole system of pumping the blood around the body is also affected. So from the perspective of treatment approach, PSH has the care service in terms of the cath lab services that we have, where we offer stenting, to widen or make the blood vessels a bit more patent, to allow blood flow to the heart for those who have coronary artery diseases. Whereas in terms of the valve, we have a top-notch heart surgeon who has basically worked for more than 20 years around the world in hospitals in Dubai, India, Australia, US, and Europe as well, giving lectures and teach and supervise all the other cardiac surgeons. And he is here in Fiji, in PSH, offering that kind of service for valvular replacement for the people. So the people of Fiji and the Pacific should now understand this advantage of accessing this kind of advanced care for their heart problem.
So what we can kata de borro chicken nanda kono borta ke Vakariba Malamala sari ka kamura ki VitiFM mai nanda bulang tiko ro turang ro clinical director Dr. Selsen Fusanga kanta mai tubalu vakakina wana project manager ni PSH ya o Solomon Sumuta and Singalebu Nikua. Talking about the services you provide to the public, what has been the response from the community so far? Turunait? Dapat na namun dubing karabi ng uno ko. Miti ko cuma na baki duti bukin 2016. May dapat cuma ng uno ko. Dapat na nung raray na libunwa. May balatan namun dubing karabi.
Kita nito bingkarabi nita batagay kemudian lini bono ni borong ti kumay. Kita ngarawat cikon na uto na kidney na ngata-ngata berto na general reconstruction plastic. Yo neuro na suitu kinamona. Kita ngarawat tarcungan na wandindikin ninra. Radiology na pharmacy katu to ko mengarabe kina indona lini bonon ni refer ta kiani se to umpalenga ni nanona babi ngadian mesati ko ngana lo ngan indona bonmo do ngana walumbula sara tukel kina na bingarabe me da wanni duru makita ko na pathway ya me le da basar na bingarabe le rilak mai yo Karena bingkara begitu binakata mbaliata ketu takiti takacuko me vida na mati kona big kilo skoro tingoi biti na pasibi ka me tangu tubi singran tangu tubi ke baka indike viole ngara mai tu iyo kasi nga tunirani wali ketu bangkara cungo na keni wali ke baka sama ni kune mai bona bi wali mbulu ni maten tu wati na private GP na bi wali mbulu sumi taler tungoi biti ketu me ketu ngara bona keni wali iyo kaya manlako mani lele utu ngara kune itu ramai lele utu ne wili sengan rautu ningkarabi yongko sake to ya utakan kona bingkarabi gana neuro urology na cardiac na katu tongo doang anak ka wenre si chungo na kena palile diles beira nan daun bingkarabi mai na primary level care mana bi nursing station kaya baka sama ni randike bi mai kina na ngoni sala totolo ta meraba ka mai ki merani tangu tubi kina na dapat di bingkara nangon salah totolo tawa nanu mati kono maten tu me bali le dira me mata satu ko na level di bingkara me virna tu me no ya no me na tholo irna we kantar tu me na pasifika wasa pasifika na totolo ngan non bali le di me ni satu ike sata fully di walo tu nangon mo
dira sa na baru satu rane demo madala na sini ko tak sense tell us more about the 24/7 services at the PSH hospital in Nandi.
Yeah, we, of course, as a private hospital, we are there to support the needs of the people in Fiji and also the region, and of course our clients from overseas as well. So we make sure that our service is readily available around the clock, 24 hours. We have a team of doctors who are working there in the day and also in the night to ensure that our service continues, and the safety of the patient is compounded by the fact that we have specialists who are also readily available to attend should there be a need to escalate care from our outpatient emergency to our specialists, especially for those who are in acute stage and needing specialist care. We have that service available in Nandi. I believe the rest of the Pacific knows about this. Dr. Vereniki Rawalui, who is a renowned anesthetist and has a humongous capacity in intensive care medicine. He's basically provide that service 24 hours as well, and readily available for callbacks to assist our team in Nandi.
How many specialist doctors are currently part of PSH at the moment?
We have two streams of specialists. One, we have our in-house specialist, and the other one, the two is our locum specialists. So the in-house specialists are the contracted specialists to work in PSH, and the locum specialists are the specialists who have their primary workers at their primary workplace, for example, Ministry of Health, and they work with us. And for us, for that portion, we only recruit the head specialists here in Fiji. Approximately about 18 of them who are currently working with us, and also unfortunately yesterday there is a new categorizations of specialists here in Fiji, and I'm happy that the volume of specialists basically available for specialist services in PSH, it has just been increased by this categorization, and overall it has been great for our specialists to support PSH in its vision to provide advanced care to the public.
Well, do you still also bring in visiting doctors from overseas?
Yes, yes, we do. PSH always prioritize our local specialists, but of course there are special areas that are limited, and we don't have the specialists here in Fiji. Those areas are the ones that we look out and seek to our brothers and sisters from abroad, Australia, New Zealand, and also India, to help us provide that kind of services. These include our heart transplant surgeon, who is also doing the open heart surgeries for those valvular and coronary artery bypass surgeries. Yep.
Totoo mo tibik na lokada da baru sigbe Dr. Sensen Fosanga, the clinical director na Valimbula, the Pacific Specialist Healthcare, wata kay turang neta project manager Solomon Sumutan na Siniko. Turang night do na tarbi kim na Siniko kibto baru tatalanga na bakang community outreach, education, sen wata kina health awareness programs wir li benua. Rene mo madal madal politik kina.
Na wala bonita ni bagi kumanin na linu warong ti kumay ketu do ta awareness talanga bimbing na ulo kotowa kelana showcase ketu andu ti kunito booth main na FMF dome ketu sa mbuli bebe kanita nga kena sono song koreti kungoi biti wakana matambos le bumbu turanga na irto na sanatan na Fiji Muslim League go na biyo kan keto semata rabiyo kan iwate ke na nito foundation itiko na nito foundation go wairan na sangan ning karabi sangan rabiang karabi ka sangan ni wirau na sendem da kai tubir erna karabi nga embi tu ngabi keto nang karabi na non raisau ning karabi sanang kai me karabi na foundation ya na buna keto biyo ka siama biyo kan ikino patigirango na nakini biyo kaningo na non rai tabi na GCC we tigir na biso ko ko merra lama e wir na non ra len bonua o ira merra main karabi na foundation main na neto da outreach gitu sasangam gitu siamo batigir ngo ke bakayan dua na bi main karabi na weekend na ito okay Nala ko na GCC, may nabi chin ka pa, kito sulit juga chin ka pa na slot na bibula. Merang karabi, siya kan som, balit na som na foundation. Yon na nono tu itabi juga nama matang bos libu turang. Na pikta ki ramai na biasa na, o ira meramai karabi. May na neto lako virani. Kito sa panu itu ni o ira to na paling bulan maten tura tu na biasa ibiti. Bata kena nito veo kan ke ira vi song go bata kena outreach. Around ira raivira mana lunu bono merato semua ye. Desember suni ke to soya ni mele establish tali sona nito tambana vi bono ibiti. Ni se to ngango iwan bata mai nanti. To sawani ni cukup ni nabi kan go sa around ni siamata cukup na lunu bono. Merah wali leli cukup mai na lunu bono.
Point number 9, PSH Hospitals has the lowest GP consult rate, $7.35. Can you tell us more about that, Doctor?
Thankfully, our founder, Mr. Pavish Kumar, has agreed to some of the executive suggestions, given the feedback from the public, as you asked before, the response from the public. Yes, they want to access the private healthcare services, but with a tag there, and the tag is the pricing. And we identified that the pricing has become a deterrent to the ordinary Fijian. So we brought our fees from $25 down to $7.35 as of now. And I'm pretty sure that basically is at the level of very affordable level to the public.
Benar sir, ini turang lita. Memang ni rangkaian cina na nota lewat bono viti yang ngongo, warta cina untuk senset ni bukan warta cina turang seolah ni nota bono rasa mengkara itu entol tantungan lebih gara bibi rana biokani. Enawas Pasifika. Tulu kata tu Tongan, tu Kuka, New Zealandi. Era ngono. Bosan we kanta main nanda tu Pasifika sa mengkara bioti yang nanda tu bolimbul.
Iyo, okey ono 50% ni tu mata ang karab cuma ni Pasifika. Kita tu basa ngabul 50% itu lawa cuma balatan tu siya kan cunikila.
Di masa.
Ono 50% ni kagitong karab sige ra la kumbay na lin may na Pasifika. Kita sambol yung karabatan ng tengah so na lin no New Zealand. Sakit lah. Iyo, tu la ko sa may chamani. Era may karabi chiko iki. Era siya mata-mata may na mabing karabi wa walimbula watake na ko makatu na medical tourism eh. Ko endo tu na ibur ni labuli weekend na non tamatan tu viti. Sembara chiko ni atau virus sarangan na kan itu me materialistic na medical tourism eh. Atau ni sa
Dona kabu.
No sa kui tele mai bango. Iliu to so kui chiko en baya. Ngo sa kui tele mai ngo ura viti. Era main karabi viti. Ndo chiko na sign bina ka weekend to viti. Ke to ni taka chiko ni na vito ko ni chiko na nonta bono na matentu. Ni sa tiga wuku chumengo ke to sa rede chiko na sala ko chumengo sa ni bonua. So na kuir sala ko sa chumai Canada mai Amerika vir nonta ni bonua tu mai kina. Merlong ngambe bangande nonta bonua mai lurai tal nonta bonua baleto ni so lebuti ko mai kya. Ebi na da vir merlong mai. So ibiti bagauka on so ngul pasyente ake to rede na bagsaut. Au bango. Sang so cindre rede na kambatin satu ngo ibiti kento menda ibiti to se ni utilize taka chuda bi karabi ngo.
Din sa bo botani libu talaga mate to vitalo ta chuda na singa binani kuwa. Tunggu na nonta bono. Tunggu nonta bono.
Nala ndre ke to rede chugo ini ta. Pati rede bono non rawali le chugo mena le ni bono. Meraya to mai bana lebih karabi ngo.
Din sa.
Ke pakai so era tu mai kantabu mai rotu mai bono balabu mai loma la kempa. Ke wasa mani redetect takikina. Na salah lah we wato tolo tagira mai matin tu me wa kusa tagira mai mera mai do wiki.
Dulu ko na.
Ke pakara mani lore ngaratunga mai na bibonua. Sono kon saya vana hata tek ramati cukup. Matin tolo cungon to nego silibun tamat sama.
Berarti kan dia ram ber
na salah mera wali levi mai kina ber.
Dulu ko na. Ibra wal misal bikin na kata Dr. Sensen, the last 2 minutes for our show today. Do you have any other comments for our listeners tuning in on VitiFM and Single Level?
Yes, of course. As we've discussed before, money is one of the main factors that deters our public from accessing private healthcare services. And in PSH, we have a great mechanism to support our public clients who need to come to our private to PSH. And we have many platforms that are readily available for the public, and it is important that our public put in their mind their health first before the money. When you think PSH, put your health first before the money, because PSH will support you by giving you mechanism that supports the payments and your worries about the payments. So I want that to the public to know that PSH, when you think about PSH, you think about your health first. Get your treatment first, then think about the money. We will work with you together to make sure that is complete.
Kota ko turita dotol itumtuk me bata berkin untuk program ni Single Level.
Iyo, nak ruangan itu via bandi takawi kan lendu bonu. Kena matai nga sember ni itu taba keto singgah taba ngango na tubuh kan induangan vingkarabi ni program kan diuto.
Iya.
Bila tal namati si tunggo keto bina kata mitu tangu tuban na kona tan sungo do musu chukuna apa amputation. Kona stroke.
Iya.
Kona cancer tunggo. Kona kaketu sangati me kona tumor.
Iya.
Brain tumor koya nakaketu sangati me ketu na do.
Iya.
Me koni kani utonga.
Iya.
Vingkarabi kete kona tando sila divi bochugo bala ke
Coba lalu bayar new facilities lebih kaget ba.
Iyo.
Bahkan dua.
Iyo. Bale tango merau me wa mau kin na misi na technology ke na kila ni bunuai.
Dono bona.
Ya ngang kay ron rau kin. Keto sa takawa wana program ni uto.
Iya.
Sa lurai na kena pabutukan to sa takapong ko bitan vingkarabi de ni uto.
Iya.
Iyo kena mal na kena bota le rau. Patar to sa chungor to na kena bunuai biti.
Iya.
Na siya tali ko may walang.
Ina.
Iyo kau ngamay ngo na technology. Ramay to ya wibiti. Angan to nakaketo na sanga ko na urology na brain tumor na to na misi ni keto sa introduce ta kamengo kondo ta kina bisel ni mona kona tumor ni mona so na ngona na bisel ngo to la ko 5 ono ne awu ngo sa ando ne awu mamanga sa wutstad
Sabina.
ya so na baleta ngon de romai pa mo wata na kila ka ni buni wai na rakila wata kina misi
Dono bona.
ya na kaketo na ka ju wirtal na boni mati
Dono bona.
meran ta chungai bici kota lindo elako
Iya.
kota lindo elako ta chungai bici lo ngamen na bingkara bibikan tai
Dono bona.
wirtu na urology cases, cancer, keto via banda berat cukup eviti na matai ni radiation therapy, kona via mata kali cancer tu dokter tu, sali lebu na cancer salurai.
Kan lebih mata
Iyo. Sembarangan ni ka keto sabi tano cukup na matai tu, me keto banda berat eviti, na radiation therapy. Baleta merani karabikin na cancer. Ando cukup na biggest skill eviti ngo na cancer na mati nuto, diabetes, kona stroke, wataken amputation. Singin don me musunam.
Iya.
Ko satu ngor na kana misi ni me sawo gina bo binak. Sa wo tsungango me wa lililin na kana tubutu wa na lini bonu. Me sabi ngo manda na musu ya wa nan duam.
Iya. Garabi nga bo binak.
Garabi nga bo binak. Iyo. Kana totolonga ka na lini bonu ratu mai na biya sebiti taunda kun ni korlilebu.
Iya.
Rani wa lililin bira kana tubutu. Kana salamer walisu. Kana ka ruangan ita.
Mai.
Ngo baka keto sa ke mami sarita ju baka indona wolo asa baka uku to kamingo.
Iya.
Era ni mai valengan na ni mambibing karabi na private play ake mami tunggu eviti
Iya.
balatan ni neto tatan rameto ya utagi ke eviti na bing karabi
Iya.
sona bing karabi chungoendre chungo balata sona policy ver na insurance na company ni insua
Right.
so ba chungo na non ra policy ke bakai chini na undo lu lakota ke ni sa ni bing karabi ko singrani karabi viti meling karabi ngai bang lagi
Oi.
iyo vitali itu ibi chingko na kenan tau na kena tamban ni bing karabi ya sona ka wai ke tu ka wai tino go baka chuko indona ririko
Iya.
ke baka satu i kena bing karabi o irna bilu tagi tu na ka wango baka mera bisa utangan non ka sarang karabi ngi ken non dalin bunu main ken ka ruwa sona ririko chungo ke baka manirtu kana matentu sangat mesali laka ngaitai
Iya.
an li laka chungai tai sang ke tu binaka me mai laka ibiti saratungo na kana kenan tau abo chungango me ka men misin amai ndakarabi ngai ni biti sa ko tan la keto me kanta bu sanan dua ngamai nawang ka me kanta bu suwa Saya wangka buka mai bun sesu, pas aku tadi wangka buka ruo, wangka buka tulu ya. Jangan ruo nakara ini tahu biar mai wata warakin na vital nonis ngin ko biar nana nandalin bonur warong tingmai.
Lalu besar turun meram, Dr. Sensen, thank you so much. Dan kita kali nada Vakariba Malamala na clinical director, apakah kena project manager, turun kita Solomon Sunguta, main Valimbola the Pacific Specialist Healthcare, and single ibu nani ko. Meda pun nada boleh keterapa, go krumundu, naik